Hey, good evening. I hope my voice is audible. I hope my voice is audible. Can anyone confirm if my voice is audible? Can anyone confirm if my voice is audible in the chat box? So today's topic we are going to discuss about the most important topic, which is ALCOA and also ALCOA Plus. So how ALCOA and ALCOA Plus are being developed, and what is the importance of ALCOA and importance of the GDP documentation practices, the best practices, how it can be utilized, and how the things will work out for good documentation practice. So I think without any delay, let's jump into the topic, which is called as the ALCOA, so which is ALCOA. So it stands for ALCOA. What is ALCOA and how it works in your clinical practices or GMP or the GDP practices. So how it has been working in our regular practices, we'll see into it. So most importantly, the clinical trials, when you work on clinical trials, the data integrity and quality of data is so much important. So the role played by the data integrity and the importance of the quality of data is so much important. So now the regulators or US FDA came into picture with a word which is called as ALCOA, and this is acronym which has been developed by US FDA in 1990. So what is this ALCOA stands for? So A stands for attributable, L stands for legible, C stands for contemporaneous, O stands for original, and A stands for accurate. So this is what you call it as ALCOA, and these are guiding principles for your GDP, or these are guiding principle for good documentation practice and also good manufacturing practices. Now each of this word in the acronym stands for importance of the specific principles. Like A stands for attributable, L stands for legible, C stands for contemporaneous, O stands for original, and A stands for accurate. So one by one, let's see what exactly this all words or this ALCOA principle stands for it. Based on it, let's discuss more on interview-based question and answers. So first one, what is attributable? So attributable means where from the data came. The data which you are entering is the source is what, where, when, and from whom the data got originated. So this is more important, which is called as attributable. Attributable, where did the data come from, and where, when, and from whom the data got originated. And we need to track all the data, trace back all the data, track back all the data, who has generated, and see what actions have been occurred. So it's a reconstruction of activities and the original data which has been coming from. So which is called as attributable. So simple words, attributable, where from the data came. The next one, legible. The legible comes from where we can read and understand the data. This is particularly useful for paper based studies, wherein it's a pretty obvious that the data should not be clumsy, the data should not be messy, the data should not be in a position to understand or hard to read, or chicken scratch, like you scratch it like anything and you are unable to read anything, so which is called as legible. So now, however, in electronic system, so in paper system we said that it's a messy, clumsy, and hard to read and understand, and also chicken scratching. So particularly in paper you say that legibility comes into picture, but however in electronic system also we need to worry about legibility. Now what is legibility in electronic system is, so when it comes, the context and information can be understood or not. So the words which are being framed, the data which has been put, is so clumsy or so unsure to understand that data. Though it is from electronic system, the words are very clear, but the sentences are not making any evidence or any understanding. Then I think that's something which is called as it's not legible. So the measures to ensure that the context of the information can be understood easily is called as legible. So for audit trail purposes. Now the next one is contemporaneous. So what is contemporaneous is data should be recorded as per the same time when action has been taken place. So when the action has been taken place, the data also has to be recorded in the same time. The action and the data should be at the same time. Date stamp is so much important. The date stamp is so much important, and the accuracy of data will be only measured with the timestamp, which can be easily tracked back. So now contemporaneous is the data is recorded as per the actions when it is being happened, or as per the time which is being happened. So not only does enforce the accuracy, but also it enforces the importance of timestamp to be done. So the next one is original. So attributable, legible, and contemporaneous. Next one is original. Data should be recorded directly from the original source, not from the secondary source. So you should not be dependent on secondary source, but you should directly entering from the primary source or original data. It should clearly distinguish what is the original data and what is the duplicate data which is being derived. Transcribed data which is being derived also should be clearly mentioned. The copies of data should be certified, so to guarantee that which is original and which is duplicate record. Say for example, the original record is source document, the transcribed information is CRF. So the original record should be clearly mentioned. So now we have discussed about ALCOA, which is attributable, legible, contemporaneous, and also the original. And last one is accurate. The data should be exactly correct and precise, and the source of data should be controlled and verifiable. So it should be accurate in nature, precise in nature, and also the sources of data should be controlled and verifiable. So now coming back to all the ALCOA, ALCOA, first one is attributable, second one is legible, third one is contemporaneous, fourth one is original, fifth one is accurate. So now attributable is where from the data we got, and legible is it can be easily read and understood. Contemporaneous is the same time the data is being entered. Original is it's directly recorded from the exact source, and accurate is it's correct and precise information is being entered. So now in 2010 what happened is we have taken ALCOA plus. Now ALCOA plus has 4 words more. ALCOA is ALCOA, plus is CCAP. So now CCAP is the complete, the first C, the second C is consistent, and third A is available, and last P is permanent or endurable. So CCAP is called as ALCOA plus. So ALCOA plus is attributable, legible, contemporaneous, and original, and also the accurate, including the complete, consistent, and available and permanent. So in 2010, we have got 4 more terms added to ALCOA. So these are terms which are complete, consistent, and enduring, and also available as a framework of handling of data in GMP or GDP. Now, what is complete? So all data should be present and complete without any missing information, and make sure that it's not falsified information or its missing information is available. So complete information should be available, particularly when you take it the data for GMP or GDP. So that's what is complete. And the second one is consistent. So now the record should be sequential and organized. So it cannot be up and down, up and down, and up and down. It should have a sequential and organized way in based on date, time, stamp manner. So the date and time stamp manner, the data should be organized, and also the sequential should be given. So that is something which is called as consistent data. And the next one is available. So the data which is being entered, the data which is being taken into the consideration for clinical trial, it should be always available. So for particularly reviewing and auditing for the record life cycle, any point in time, the data which is being entered should have should have the reviewing and auditing of the original records, and all available data should be available for particularly into this characters. And next one is permanent or endurable. Data should not only recorded in authorized but also maintained in a format where the lifelong the documents are being can be used. The permanent documents should be used. So now ALCOA plus is ALCOA CCAP. ALCOA stands for attributable, legible, contemporaneous, original, and accurate. CCAP stands for the first one is complete, consistent, available, and also the permanent. So complete is all data should be completed or without any missing information, and also the consistent is the record should be sequential and organized. Available is it should be accessible for auditing and reviewing. The data must be recorded in controlled format. Permanent is the data should be recorded in order to maintain the format of life cycle. So now coming back to good documentation practice. So good documentation practice, records or evidences. Records or evidences. It should be entered whenever the event has happened. So now a very clear statement is being given. If it is not documented, it is not happened. If it is not documented, it is not happened. If it is documented, it happened. So GDP proves that it happened. The activity happened because of the documentation. Regulatory agencies make sure the importance of GDP through various laws, regulations, and also guidelines document. It gives a more stress on documentation, the GDP. So we have to have good quality management practices for your GDP, good documentation practices. And if you follow the GDP in effective way, then you can avoid the company getting 483 warning letters from your FDA. And now GDP and implementation most common methods. The first one, all documented evidences are being accurately entered and reliable. Tracking all the changes and archiving of documents, training of the records, and centralized databases. All this makes sure that the GDP is being entered or GDP is being maintained. First one is ensure that processes and documents are clearly managed, the data is reliable and accurate, and the track changes are being done properly. Archival of documents, training records, and central databases for accurate, relevant stakeholders. So this is what you call it as the implementation of GDP. So now, what are the best practices? Recording all entries. Recording all entries when it happened. Avoid backdated entries. Strictly prohibited that backdated. Yesterday it happened and today we are entering it. So please do avoid this kind of environment or activities. The recorded activities must have a signature, date, and time. Individuals who have performed this. Legible, readable format has to be archived. And shorthand notes or vague statements should never be used. Hardbound controlled logbooks and accurately used SOPs. Photocopy of data, original copy and photocopy has to be given very clearly. So now this is all about your the best practices for GDP. So now today I have spoken about the first topic, which is what is ALCOA. So ALCOA stands for ALCOA, wherein it stands for attributable, legible, contemporaneous, and original and accurate. What is attributable is the attributable is where from the data came, what is the source of data. Legible is it can be clearly read and understood. Contemporaneous is it should have the date and time stamp when the activity has happened. Original is data is being directly reported from the primary source and not from the secondary source. And accurate is data is recorded directly and it is correct and precise information is being entered. Now ALCOA plus CCAP. Now CCAP stands for the first one, complete, consistent, and also available and endurable. So complete is all data is available, which is complete, and the data is been making sure that evidence without having any falsifying information. Consistent is with a sequential organized manner with date and time stamp, and available is the data is available for auditing and also for reviewing. And permanent is the data is being made in a particular format, maintaining for self life. Good documentation practices If it is not happened, it is not documented, or if it is not documented, it has not happened. So ensuring the process is documented clear manner, tracking all the changes, archiving of documents, training personals, and central database has to be maintained. And best practices, best documentation practices. What are the best documentation practices? Is write whenever it is being performed, or do not use the backdated details. Should be legible, readable format. Short notes or the vague statement should be avoided. Hardbound logbooks can be used, and photocopies, original records and photocopies can be used for particularly your GDP. So now today I have covered most of things about ALCOA, ALCOA Plus, and its importance and best practices in GDP, and how this is being used. So now particularly in interviews, they will ask these questions. What are the principles used in ALCOA? So what is the full form of ALCOA? So now I'll hold it for a minute here and I'll open for questions. If students have any questions, they can ask about the ALCOA. About ALCOA, every interview they will ask about ALCOA because clinical trial is bounded with regulations and guidelines. So ALCOA is being used for CRCs, CRAs, data management, pharmacovigilance, and also for all kind of activities where there is a documents. And in every clinical trial activities, there are documentation. There are activities which are being performed. So now this is something which has to be understood about the GDP or good documentation practices. So now I'm open for questions. Any questions anyone have? You can post it to me so that I can answer the questions. So I'll wait for questions. If any questions are there, so that I can answer these questions. Okay, so I'll put this way in one more time. They might ask you in interviews that what do you know about ALCOA and ALCOA Plus? What is the difference between ALCOA and ALCOA Plus? So ALCOA is without CCAP. ALCOA Plus is with CCAP. So this is something which is more important. So what is the ALCOA Plus is you have details of the CCAP, which is complete, consistent, and available, and also the permanent. But when you say ALCOA, it does not have the CCAP. So there might be questions regarding ALCOA saying that how do you make sure that ALCOA is being maintained or not? If a documentation is being given accurately and the track changes are being given, date and time signature is given, date and time stamp is being given, then I think that's something which is more important for you for ALCOA. So I think we have got a question. How can ALCOA be maintained when using paper documents? See, ALCOA is being maintained for paper and electronic documents, both documents, but particularly in paper, it has a different story for ALCOA. So ensure that paper records are first one accurate by double checking the entries of the data which is being entered, and also maintaining the legibility. So whether it is being clearly understood or not, the clear and standardized handwriting is being used by using capital letters, and the originality should be preserved. The originality should be preserved by avoiding alterations and also by avoiding strikeout or making without any signature and date we are changing the data, then it is a problematic zone. So now ALCOA principles for paper study documents is accurate by double checking, legibility, clear and standardized handwriting, and preservance of originality. So these are the four things which we can have during your ALCOA or ALCOA details. So now coming back to if we want to speak about ALCOA in electronic data capture, so you invest the time in access control. So implementation of robust access control to safeguard the data integrity. The data integrity should be safeguarded in such a way that others should not see this data. And make sure that regularly you verify and data for completeness and also for your logical consistency by thorough audits, and also version control documentation and authentication of electronic records. So when you speak about ALCOA in electronic data management, first one is implementation of robust access control system to safeguard data integrity. and regularly verify the documents, and also for the completeness audits, and also make sure that the version control is being done and training records of the employees are being maintained. So I think with this we have come to an end of the session, which is ALCOA. And what is the ALCOA? History of ALCOA. What is the difference between ALCOA and ALCOA Plus, and how GDP is maintained? I have taken a couple of questions also, which are relevant for interview-based questions. Thank you so much for joining today on today's live, which is GDP or ALCOA and ALCOA Plus and GDP implementation. Thank you so much. Have a nice, wonderful evening. Thank you.